it typically is sort of a region of about sort of 1 metre around you. That's kind of the transmission zone. So if you stay sort of 3 or 4 or 5 metres away from somebody, chances are you'll be fine. So is there a risk of Ireland getting a couple of cases? There probably is. One of the things that probably helped us in the early stages is that we have no direct flights to China at this time of the year, and we certainly had no direct links to sort of the Wuhan city in Hubei province at this time of year. So that was a positive thing. I suppose a huge amount of work has been done at the government level between the Department of Foreign Affairs, the Department of Health, in identifying people sort of early on who were in the affected areas and may either have wanted to return to Ireland or may have wanted just even sort of some consular assistance of some shape or form. So we have a good handle on Irish citizens in the area, but equally some of them want to repatriate, and equally there would be sort of tourists coming over from affected areas that we were unfamiliar with and unaware of. There is certainly a chance, and we wouldn't be surprised if we saw a couple of sort of small numbers of cases in Ireland. But the good news, I suppose, or the positive aspect, is that we've seen good infection prevention control practice can prevent it becoming established in a new country or a new city. Because again, if we look at the likes of, say, Germany and Berlin, or in the UK and London, or in France, the cases that have been imported there haven't sort of kicked on to cause sort of significant transmission chains, nor have they resulted in sustained human-to-human transmission in the population. The new coronavirus, or SARS-CoV-2 as it's now called, is one of a large family of coronaviruses that ultimately they can infect animals, humans, birds. So this is the 7th coronavirus that infects humans, and all of the others cause respiratory illness to some extent. So there are 4 coronaviruses that we would see all the time that are sort of endemic in the human population. They cause the common cold, and pretty much all of us would have been exposed to those at some shape or form. So because they're so mild, we don't have any treatments or any sort of or vaccines for those, but they're with us all the time. The coronaviruses, I suppose, came to attention back in 2002 and 2003 with the arrival of SARS. So that was the 5th human coronavirus, if you like, and the reason that caught the attention, I guess, was because although it only infected sort of 8,000 people worldwide, it had a case fatality rate of about 10%. So to put that in context, seasonal influenza has a case fatality rate of about 0.1%. So 10% was impressive, but that virus is no longer circulating. In 2012, a similar thing happened with MERS coronavirus. It stands for Middle East Respiratory Syndrome coronavirus. That emerged in Saudi Arabia. That again seems to have come from an animal sort of host and crossed over the species barrier. That had an even more concerning case fatality rate of about 35%, but never became readily transmissible. Since 2012, that's only infected about 2,500 people. So this new virus, which we're now calling SARS-CoV, is the 7th human coronavirus. And what's concerning about this, again, so ultimately it seems to have come from an animal reservoir. There are huge numbers of coronaviruses in bats. We know that. So after SARS, a lot of surveillance was done, and a huge number, sort of hundreds of coronaviruses have been identified in bats. So we're assuming at this point that this new virus ultimately came from bats as well, but we haven't yet identified how it got from bats into humans. We know that a lot of the early cases were associated with the live animal and seafood market in Wuhan in China. So that's really the theory at the moment, is that there was some animal there associated with that market where people were exposed. We're not entirely sure how it first crossed the species barrier from animals into humans, but in essence, like other coronaviruses in humans, they all seem to involve the respiratory tract. So what the virus is doing is that it's getting down into the lungs, into the airways, it's getting into cells, it's replicating, and then it's being shed again. So from what we can ascertain at the moment, it seems to be spread through droplet spread, so that means sort of people coughing and sneezing. But also if people sort of cough into their hand, they can sort of pass by direct contact if they then shake hands with somebody, or if they sort of touch doorknobs or something like that. But it's in essence, it's quite similar to what we would see with seasonal influenza, or indeed the other human coronaviruses, that it's sort of droplet spread. And what that means is that it typically is sort of a region of about sort of 1 metre around you. That's kind of the transmission zone. So if you stay sort of 3 or 4 or 5 metres away from somebody, chances are you'll be fine. Whereas with the other viruses that we would talk about may be sort of airborne, and that means they can transmit further, and that's sort of more challenging to contain. But as I said, at the moment, this new virus seems to be droplet transmission. So we know, say, if we look at something like measles, which is highly infectious, the R0 is about sort of between 12 to 18, which that means, so for every individual case, if you have a susceptible population, another between 12 and 18 cases on average will result from that single case. If we look at seasonal influenza, it's about 1.4, and if we look at this novel coronavirus, at the moment the estimates put it sort of between sort of 1.5 and 3.5, but we're not entirely sure exactly where it lies yet. But I think the other thing to highlight is that that's an average number as well, so it doesn't mean that will result from every case, but it means an average across the population. And I suppose the significance of the R0 from an epidemiology perspective is that if that R0 value drops below 1, it means that the epidemic should peter out, because from the pathogens, from the virus perspective, each case needs to result in more than one case for it to actually survive. So if the R0 is greater than 1, there's the possibility of sustained human-to-human transmission in the population, and the epidemic may continue to run and run. But if that R0 drops below 1, then it should peter out naturally, in essence. Because it's so new, we don't have any treatments, and we don't have any vaccine. And the thing is, there's still a lot about the virus that we don't know. So when we're looking at new pathogens, the things we're trying to identify is, what the incubation period is. So that means, what's the time delay between a person acquiring the infection and between them developing symptoms. Another question that we want to ask then is, during the incubation period, are they infectious? Are they capable of transmitting the virus? Because if they are, that makes it very challenging to contain them. If we look back to SARS, people were only infectious with the onset of symptoms, and that meant it was relatively easy to control them, because you identify someone who's sick, you isolate them, you identify their contacts, you quarantine them, and then you can control the infection quite quickly. But if somebody is transmitting the virus before the onset of symptoms, it makes it far more difficult to control that. And we see that every year with seasonal influenza, for example. People can transmit the virus before the symptoms start, so that's why it can spread so quickly. It's sort of isolation and quarantine don't really work if the virus can be spread during that incubation period. So the majority of people infected with a new virus seem to get sick after around 5 days, generally speaking between 4 and 7 days, and that accounts for most people. We believe the incubation period at this stage goes out to a maximum of about 14 days, but it's a very small number of people that would take that long. Really, that's what we're operating on at the moment. Because it's a new pathogen and a new virus, we still need to sort of confirm that definitively. What we're trying to say to people at the moment around the coronavirus in Ireland is that if they have travelled to mainland China in the last 2 weeks and they have developed symptoms, then we want them to engage with the healthcare service. So we want them to let us know that they're here, but equally we don't want them to go to a crowded emergency room or a crowded or GP surgery. What we want them to do is contact their own doctor and say, look, I have an illness, I've got a travel history, and then through public health it will be coordinated in such a manner that they can come either to the hospital and be tested, but they'll be brought in sort of by ambulance in a controlled way, tested, and then ultimately given a diagnosis one way or the other, and then either admitted to hospital if they need to be admitted to hospital, or discharged home. But we do want people to let us know about their travel history if they're here. Ultimately, there's no evidence at all that the virus is circulating in Ireland. So anybody who has no travel history and is sort of developing a respiratory illness themselves, it's likely to be something seasonal. Like if you think about it, we're actually sort of still at the tail end of our own influenza season. So influenza is still circulating in the community, and equally there's a lot of other respiratory viruses that are endemic in the human population and that we would see sort of every year in Ireland. So if somebody hasn't got a travel history and hasn't been exposed to somebody infected with SARS-CoV-2, then there's minimal to negligible risk to them in Ireland at this point in time. I suppose the cases that sort of hit the media are often the most severe cases, where the cases of people have died or people have been severely unwell in ICU. So if we look at the numbers, that the Chinese released a report there earlier this week where they looked at over 70,000 cases, and about over 80% of those cases are mild. They have a mild illness, and the majority of those will recover with no sort of adverse effects. So that's sort of a positive finding. Now obviously, sort of just under 20% is still a significant burden of disease. So people do get severe illness, people do need to go to ICU, and so there's ultimately a case fatality rate there of in the region of 2%. But no, the majority of people will have a mild illness and the majority of people will get better. And equally, outside of that number of reported cases, it is likely that there's another group of people who had no illness at all and actually never even presented for care. So one of the unanswered questions at this point is, if the 75,000 is the tip of the iceberg, how big is the rest of the iceberg? And we're not going to know that for a number of months at least.